You want to save children from unnecessarily dying. You want to protect adults who are at high risk for disease, and do all of this among people who are most marginalized. What a wonderful virtue! Where do you begin? How do you launch an international healthcare career? Well, begin with a vision of the world. Today, some 70 million people are living as refugees. They've been driven from their homes because of war, because of persecution. Millions more have been displaced because of natural disasters, earthquakes, hurricanes, fires, and hundreds of millions around the globe continue to suffer from epidemic diseases, tuberculosis, malaria, schistosomiasis, COVID. Now, everything we talk about regarding marginalized people is also on behalf of those who are in our communities right here. When I use the word international, I mean every people, everywhere. And often those close by are elderly, disabled, veterans, non-English speakers, migrants. I'm a follower of Christ. My values are highly influenced by the way Christ interacted with the marginalized people of his day. People who were often outcast, sick. And he told the account of the Good Samaritan as an example for all of us. And in this story, a common person is traveling from one city to another when he is attacked. He's brutally beaten, robbed, and left for dead. Well, a religious person walked by and noticed him, kept right on walking. A philosopher walked by, noticed him, stayed on his path. And then there was another common person, actually a foreigner, who noticed the man lying, bleeding, and had compassion on him, picked him up, cared for his wounds, paid for his rehabilitation. These are timeless virtues that are applicable for us today. In high school, I read the book, Deliver Us from Evil. It was the account of Tom Dooley, a St. Louis physician serving in the Navy. He was tasked with caring for Vietnamese refugees at the outset of the war. Thousands of people every day arrived in the camps under Dooley's care. They were hungry, they were cold, they were separated from their children and their parents, they were sick. And as I read of Dooley's compassionate care for these people, I thought, that's what I want to do with my life. And so as a medical student at the University of Missouri, Kansas City, I was intentionally looking for opportunities to emulate Dooley. As a medical student, I worked at the Clínica Evangélica Morava on the eastern coast of Honduras, where my supervisor was Sam Marks, an American physician who had been living there for 30 years. I'm all about short-term trips. I think it's important to create a vision, but for a true impact, we need individuals who are willing to dedicate significant parts of their life on behalf of such people. As a resident physician, I worked at the Galmi Hospital in West Africa. I chose Galmi Hospital because this was the poorest country in the entire planet. And then as I was finishing up my formal education, I was looking for a longer-term commitment. And I chose the Shanghai Charity Hospital. China at this time was a developing country. There were no cars. Nothing had been painted in 30 years. And our leading diagnoses at Shanghai Charity were tuberculosis, rheumatic fever, schistosomiasis, diseases of poverty. Finishing up my term at Shanghai, I moved to Angola in southern Africa, a nation best known for the longest running civil war in African history, 40 years. And throughout that time, there were 2 generations who grew up with disease, with hunger, and more landmines per person than any other nation in the world. Now, I was highly influenced by role models, by Tom Dooley, by Sam Marks. What about you? When you think of people that influence your career decisions, who comes to mind? Your great-grandparents know all about Albert Schweitzer. He was a British-German philosopher, theologian, who served his entire career in Gabon, West Africa. More recently, there have been those like Tom Dooley, and working in HIV care, Paul Farmer, Rwanda, Haiti. But what about you? You might become the next influential role model. I am inspired by the courage, by the virtue, by the kind intentions of young healthcare professionals today who are looking beyond their own self-interest towards what can they do on behalf of others. We know the world's in need, but there are decisions that you're going to have to make. And so when you think about your pathway forward towards an international healthcare career, what kind of decisions come to mind? Well, let's begin with the fact that you and I are super privileged people. We have education, we have friends, we have vision, and because of this, everybody wants our attention. They want our vote. They want us to join their club. They want our purchasing power. And so we have to choose. Who are we going to follow? Where are we going to invest? Now, I find that when it comes to big life decisions, there are certain principles that you can follow. Decision-making is like other kind of skills. It's like learning a sport or learning an instrument, learning to manage your money. You can really get good at it. And it begins with prayer. I find that even people who don't consider themselves spiritual tell me that they often pray when confronted with a major life decision. Be anxious for nothing, but in everything, by prayer and supplication, with thanksgiving, and the peace of God, which surpasses all comprehension, will guard your heart and your mind in Christ Jesus. There is a sense of clarity and peace that comes through prayer. Apply that as you move forward with your big decisions. Now, for every option, there are pros and there are cons. There are good, there are bad. Our poor decisions are based on illusions we believed at the time, and our better decisions on realities that we recognized in time. Men, do you have the perfect pocket knife? I mean, it's small, it's compact, but it has all the tools you could possibly use. Never breaks, it's always sharp. Doesn't exist. There's always a compromise. Women, have you met the perfect guy? He's handsome, he's smart, he's rich, comes from a good family, he adores you. Doesn't exist. Now, that's not to say that you won't choose a pocket knife, that you won't choose a good guy, and I wish you the very best in that. But there are pros and cons associated with every choice. And so know what you're getting into before you make a commitment. As I was choosing what nation to serve in, I made a grid. Across the top, I put the countries that I was considering in the columns, and then in rows down the side, I put my criteria. I assigned a number to each one of them. 3 was good and 1 was bad. And then I added up the columns to see which was the best place for me to go. Now, that sound a little compulsive? Yeah. But I bet you might have done it as well. It helped to give me clarity about how I was going about making my decisions. And then get some recommendations. Talk to someone who is a little bit ahead of you, 5 years ahead of you, 10 years ahead of you, and ask them how they went about making their decision. Ask your parents. Yeah, ask your parents. I mean, they may not know anything about what kind of career track you're taking, but they know you well. Show them respect. And so I went to my dad and I said, hey, I'm going to move to another country, going to move to China. It's really cold there. My Mandarin isn't that good. They're not going to pay me. What do you think, Dad? And he said, why would you do that, son? But then he was very proud of me, and he boasted about me. And your parents will boast about you as well. And then don't be in a big hurry. Big decisions are usually not urgent. Urgent decisions are usually not that big. Give it time. Apply the principles of wise decision-making toward your steps forward with your career. Now, why even have this conversation? What is it about a career focused on marginalized people that's different from the norm? Well, there may be unusual diseases. Actually, this is the easy part. You're really smart. And you'll find a mentor who can show you how to manage those unusual problems. A bigger challenge is working with low resources. You and I go to health education school in big medical centers. But when you're in a setting where you don't have those consultants, you don't have those imagings, you don't have those therapeutics or those laboratories, it's a huge challenge to adjust the way you go about implementing healthcare. The biggest challenge is often cultural and language. People who look at health and disease from a perspective that's way different from your very own often is the biggest barrier. And then you and I are carefully trained how to care for people one by one. But what do you do when an entire community suffers? And there's not enough of you to care for them one by one. And so leadership skills, population-based interventions are not traditionally addressed in our training. Some of the barriers that we need to overcome. What field should you go into? Amid all of the specialties available. Well, my short advice is choose the field that you really like. Choose the field that you could do for the next 50 years. You could do it in India or you could do it in Indiana. Chances are there are enough people who will benefit from your expertise. Are you interested in eyes? Everybody's got 2 of them. Are you interested in obstetrics? Half the people on the planet need an obstetrician at some point. You will find a way to apply your particular skill set on behalf of such people. What about a degree in public health? Many people working in underserved populations have an MPH. Now, these are fascinating degrees, a bit expensive. And the truth is, the most important elements of public health you knew in high school. Wear your seatbelt, eat right, get your vaccinations. You can apply those moving forward in your career with great effect. What about a tropical medicine degree? You could go to London or Liverpool or Brussels or Tulane and spend a year studying exotic diseases. If you have the time and the resources, I would do it. It'd be fascinating. The big drawback is you won't actually care for anyone who suffers from those diseases. They don't happen in Brussels or Tulane. I lead the Institute for International Medicine. We're a graduate school equipping healthcare professionals with the unique skills they need to serve the world's most forgotten people. What we've done at Inmed is taken the most important elements of public health education and tropical medicine application and put it into programs that are affordable and streamlined. Our biggest event of the year is the Humanitarian Health Conference. Every springtime, we gather people from around the world here at Kansas City for not only learning about these kind of subjects, but maybe more importantly, meeting the individuals who are doing this kind of work, the kind of role models that could help influence your career. Inmed teaches courses in international medicine, international nursing, international public health, healthcare for marginalized Americans, refugee care, and then we also teach practical skills, wound care, complicated obstetrics, ultrasound. And then with that kind of background, you're ready for a supervised international experience. We have faculty in 25 countries with whom you can spend weeks or months learning how to apply your skills on the ground on behalf of people in Africa, in Asia, in the Middle East, Central America. And then we recognize our graduates with a professional diploma in international medicine, international nursing, international public health. It shows that you not only have some head knowledge, but you also have got some real practical experience applying these skills on behalf of marginalized people. Inmed also offers a professional master's degree in international health. We take these elements that I just covered and add to it robust epidemiology and a scholarly project for the MIH, the master's degree in international health. Now, you've prepared yourself well. What are you actually going to do when you arrive in your community? Are you going to do patient care? Are you going to do administration? We've got to have someone managing logistics, public health interventions, research. Consider the example of Dennis Burkitt. Now, Burkitt was a British GP who was serving in Uganda in the 1950s. No special training, but he was an inquisitive person. And he noticed all these children who had masses in their necks and in their thorax. And he thought, what could this be? And so he started collecting some data on them, did some biopsies, and identified the malignancy, Burkitt's lymphoma, that we all study today. He was just an inquisitive, observant GP. Now, you're not going to do this kind of work on your own. You're going to do it in cooperation with others. And so, should you first choose the ball team or the ballpark? And what I mean is, are you going to choose the organization that you're going to work with and then go wherever they send you, play ball wherever they may have you, or are you going to choose the ballpark, the community that you're going to serve, and you're going to play ball with whoever is there? Well, there are pros and cons, there are virtues to both of these. Let's begin by focusing on the ballpark, the community that you want to serve. How would you choose? It's a big world. Well, start with contacts. Do you know someone there? Have you visited there before? Do you speak that language? Are you familiar with that culture? Do you have a particular skill set that is needed in that community? If at all possible, make a visit. Try to establish even a heart connection with that community that you want to serve. Now, if you're aiming for the ball team, there's a lot of different kinds of ball teams, organizations to choose from. There are government teams, like the CDC that works internationally. There are non-government organizations that are faith-based, like Samaritan's Purse. There are secular non-government organizations, like Doctors Without Borders. Academic institutions. Tulane University has service centers all over the world. You could even work for a for-profit company and spend your off hours serving marginalized people. Many of my friends around the world do that. They get their income and they get their visa and their housing from the company, and then they use their off hours to serve the vulnerable people in those particular populations. But in choosing an organization to serve with, you want to consider what are their resources, what's their experience, can they aid you if you get in trouble? Most importantly, how do your values line up? If your values are in sync, chances are you'll have a good relationship moving forward. Begin with the contacts that you already enjoy. Do you know a service organization? Is there a community that you already have a connection to? Check out the potential for future interaction, with those connections that are already within your network. How about language learning? If you're going to serve people whose primary language is different from English, then you're going to have to make a huge investment, adult language learning. Now, I spent a year of my life just learning Portuguese, the language of Angola. I've had a Chinese tutor for 20 years. Big undertaking. Now, I failed high school French. more than one semester. I thought to myself, there's no way I'm ever going to master a language. But the reality is that language learning is all about motivation. I had no reason to learn French. I didn't know a single French-speaking person. But I found that when I got in a community where I absolutely had to speak that language, I was able to learn. And you will too. When are you going to do this? Are you going to finish up your training and get out there and start serving that community as soon as possible? Wonderful. How about later in your career? Quite a number of mid-career healthcare professionals come to me and say, it's finally time for me to do what I've always wanted to do. Can you help me get started? That's good too. And even more say, I've got my vacation time. Can I use my vacation time? In Houston, in Haiti, in Honduras. Certainly. If you do that kind of intermittent service, I encourage you to go back to the same place. You will be more effective over time. They will trust you more and give you more responsibilities. You'll build more of a legacy moving forward if you focus on a particular career moving forward on behalf of a particular people. Now, up to this point, we've been talking about career decisions. What about your family? What about your personal life? Let's delve into those kind of choices. First up, what are you going to do about debt? This is the number one reason why young healthcare professionals tell me they can't do what they want to do. They owe. Well, first up, focus in on eliminating that debt. And that means continue living like a student. Did you go hungry when you were a student? Probably not. Stay at that lifestyle level and pay down your debt. You'll find that you are out of debt far quicker than many of your colleagues who graduated and bought a big house and a big car and they're still paying off. And then you're going to enjoy this wonderful freedom moving forward to do what you want with your career. You're also going to have to protect your health. If you suffer from a catastrophic disease or injury, you're not going to be able to move forward. And so your lifestyle, your fitness, your weight control, your medical management is really important. What is the number one cause of death among Americans who travel abroad? It's not malaria. It's not yellow fever. It's not even a stroke or an MI. It's trauma. It's trauma. So stay out of those little brightly colored minivans and do not rent a moped. If you protect yourself from trauma, chances are you're going to do great over the long haul. And then what's this going to do to your family? Of course, you need to choose a life partner who wants to do what you want to do. Be in sync there. And then most couples report that when they live in another culture or in another country, they're actually closer. There are fewer distractions. They have more time together. Similarly, their children report high satisfaction, more family time together. Living in another culture is not a panacea for a happy family, but the research shows that it does not seem to hurt at all. You may be a person of faith. Lean into that faith as you pursue what is by definition a very difficult career track. Build into the community of faith that you're part of as you go through every phase of your career development. And then finally, make sure your documents are in order. Do you need a license to practice in that particular country? Find out. Most nations require you to have a license, even if you're only there for a week, even if you are only providing charity care. So be respectful of the nation that you might want to serve and have a license to practice. So in summary, choose wisely. You want to save children from unnecessarily dying. You want to protect adults who are at high risk for disease. And do all of this among the people who are most marginalized. What a wonderful virtue. Choose wisely. Apply the principles of decision-making and step out boldly on behalf of the world's most forgotten people.
Such incredible insights from Dr. Nicholas Comninellis, as always, just amazing stuff. And as a non-medical professional, I sit here and just amazed at the work. And Paul, Jennifer, to me, again, as a non-medical person, I sit here and part of it sounds like a foreign language to me, but the common denominator is just the heart for God and the heart for missions and the heart to see people transformed, and using the unique gifts that God has given each of us in order to do that really is the heart of M3, isn't it? It is.
And especially, as Nicholas mentioned, focusing on marginalized people. And that's who Jesus was interested in, and that's who he wants us to be interested in. And Nicholas, I've told you this before, but I thought that was one of the best talks we've had at M3. Just so, what I call it is just nuggets of wisdom all the way through, just practical advice, how to make decisions, just anyway, I thought it was just a tremendous session, so thank you so much.
Well, I'm grateful. This is the talk that I wish I had heard when I was 20-something.
Exactly.
You know?
Exactly.
We have ideas like this, but then getting to go back and after a few years experience and test those ideas have been really helpful.
Yeah, I think the old adage applies that we live life forward, but we learn it backwards. And so anyway, I wanted to comment on one thing. I love the fact that you said, you know, some of us can serve short time or extended short time, longer times. We serve 3 or 4 months a year, but you made a statement I think that's really important for people to hear. We need people who will give significant amounts of time serving marginalized people. And I think, can you just elaborate on that? I mean, we're talking young people who are willing to give significant portions of their lives to make a difference. Can you make a comment about that?
Sure. Well, every community, every people that you might want to serve or have an interest in has got their own history, their own coded language, their particular challenges, and those are things that are difficult to learn.
Exactly.
You know, even after 2 years, 3 years, you know, many of us who have stayed long-term would say that, gosh, I was only beginning to comprehend.
Yeah.
And then, as some of the other presenters have said so far this morning, it's only after years of influence, you know, 5 years, 10 years, that someone that they have been sharing Christ with or modeling faith with began to really show an interest.
Yeah.
And so my hat's off to those people who have endured, you know, like my very first preceptor in Honduras, 30 years, you know, had been there.
Yeah.
So we need more of them.
Yeah. I think another point that you made that was really, really, I hope people don't miss, and that is the fact that you said that if you're gonna do short-term missions, go back to the same place. And Jen and I have found that with ourselves. You know, we'll go 3 or 4 months a year, but we go back to the same place until God tells us to go somewhere else. Then you develop relationships. Then it doesn't take nearly as long to get into the rhythm of the hospital. So I thought that was a very, very wise piece of advice.
Yeah, thank you. And I realize that you've been doing that, Paul, for all of this extended period, and that's been my pace now. After my initial years in Angola in the 90s, I've been going back every July for the last 18 years, and I essentially do their vacation coverage. You know, they know that I come in July, they plan their vacations for July. Yeah. I mean, that's one way it can work to contribute to the sustainability of a ministry, even though we're doing it partial time.
Yeah, and I guess that's exactly what we do. I go relieve missionary surgeons so that they can have a break. And boy, you're talking about people that need a break. You know, the missionary surgeons, the missionary doctors, they need a break. So I wanted to, after listening to that about Inmed, I think I want to go attend Inmed. After all these years, I think I want to come attend. But I wanted to ask you, how can people find more information out about Inmed?
Yeah, so our website is a really good place to start, and it's simply Inmed, INMED.us, and it's the abbreviation for Institute for International Medicine. And I'll brag on ourselves, we're really good at responding to people, and so if you make a phone call, if you send us a message, we'll be right on top of it, getting back with you to show you the steps.
Good. Now, one question I had is, who is this? Who can participate in Inmed? I mean, is it just doctors and nurses and medical students, or what group of people are you interested in having?
So our focus is healthcare professionals and healthcare profession students.
Okay.
And so if you're in physical therapy, laboratory science, dentistry, pharmacy, any of the healthcare professions or schools of the health professions, then you are our particular target. Now, we also have a track for undergrads in which we emphasize public health skills, community development, disease prevention. And those undergrads can earn a diploma in international public health, which is useful for creating insight into the field, and it also looks really good on your application to health professions school. Moving on.
So, Nicholas, just briefly, how does it work? Is this done virtually with some in-person study in Kansas City, or how is it done?
So, the core courses can be done entirely online. Most of them are 8 weeks long. There is a meeting with the faculty once a week. There's assignments that are due once a week. There's live interaction with the faculty. So it will be a role modeling kind of experience as best we can do in a virtual environment. Now, we also teach in-person hands-on skills. So if you want to learn ultrasound, we teach an in-person ultrasound about 6 times a year, as well as newborn resuscitation and complicated obstetrics and wound care skills and things that are really important, but you really can't get proficient at it online. So that is an option to do in-person skills. But what we're best known for is actually the international preceptorships, where we'll match you up with a supervisor in a developing country, who will show you how you apply that head knowledge on behalf of these people.
Now, I understand you have a conference every year, and you have one coming up. Tell us a little bit about the conference and when it is and how people can find out more information.
So the second weekend of June will be the 17th year of the Humanitarian Health Conference. And this is an opportunity to invite people who may be far from the kingdom. We're very intentional about creating an event with a healthcare education focus that will be a crossover kind of experience. So you can invite someone who may be outside the kingdom, and we think that in this environment, they'll not only learn about compassionate healthcare, but they'll also be exposed to people who are walking with Christ and that influence. The other key is connection with sending organizations, to have that kind of FaceTime with people with whom you could serve, with whom you could train, with whom you could create a vision for what's next in your life.
Now, what are the dates this year?
So it will be June 11th and 12th, which is a Friday and then a Saturday morning in Kansas City. You can also join us online if you wish.
Good. So you're still hoping for the in-person conference, and so are we for you.
That's right. Thank you.
Yeah, good. Anything else, Chuck?
Oh, yeah, we have a couple of questions and some encouragement that I want to give you, Dr. Comninellis. In fact, from Mimi, this comment just came in, and I was encouraged by it. I'm pretty sure you will be too, as well as Paul and Jennifer. Said, "Thank you so much, Dr. Comninellis." And here's the quote: "You may have just provided the practical steps and tools that I need to take in the next chapter of my life." That is, I thought, a powerful comment from Mimi. That's really kind of what the heart of M3 is. It's like, yes, that's it. That's the answer. So encouragement for you as we get into a couple of these questions. Here's one. Just recently graduated with a BBA in healthcare administration. Have always had a heart for missions. I just don't know where to start. Any thoughts?
We need administrators. Like I said, someone has got to manage the logistics. The transportation, the visa, the travel, the financing, the hiring. These kind of ministries do not exist without those kind of logistics. And so someone like this who is formally trained in administration can be a wonderful, wonderful complement. Now, if you feel like you're still not quite sufficient, then adding some public health credentials could also supplement your career track. But I wouldn't feel bad about having an administrative background. It'll put you to work.
Yeah, so a great starting point, a resource, maybe a place to go to find out, oh, I know, maybe the m3missions.com website, right, Jennifer?
Right, right. So many good resources on there.
Yeah, and all of the ministries and organizations that we're connected with, you can find information and get more details on there. So make sure you take advantage of those resources tabs. Obviously this year M3 is not in person, it's virtual, but we have a virtual exhibit hall for you, places that you can find and get connected. In fact, Dr. Comninellis will still be with us for a couple of more minutes, and our Q&A is still open. So right on the tab, if you have a question, make sure you go ahead and fill that out. Here's another one from Christopher. What are the steps to take to start serving in a medical facility or maybe even an orphanage in a war-torn nation such as Afghanistan?
Well, I would begin with your sending organization. Find a group who's already doing that work, who has experience with that work, who can guide you through the intricacies. Just by definition, that kind of service is going to be unpredictable.
Yep.
And so you need to have an organization who is experienced with unpredictableness. But hats off to you. God bless you. We need individuals who are willing to serve in the midst of that unpredictability.
Well, Dr. Comninellis, thank you for taking the time to join us today. We loved your talk. We loved having you as part of the M3 family. Thank you for taking the time to join us on some of this Q&A as well, and blessings on you and your organization and your conference coming up.
Thanks.
Thank you.